Thanks, Mr. Chairman. Welcome, one and all. Nice to see you. A question regarding the Medical Supply Chain Resiliency Act. COVID-19 pandemic taught us a bunch of different lessons, as you know, about the resilience of our nation's supply chains, especially with respect with medical supply chains. Across our American, certainly in my home state of Delaware, but we've heard from patients, we've heard from caregivers, we've heard from providers, we've heard from manufacturers about the lack of access to medicine and to medical equipment and how that impacted their lives. The aftermath of this once-in-a-generation health crisis emphasized that we, as lawmakers here and across Capitol Hill, need to take action to shore up our access to goods around the world. No one should have to worry about not being able to access the treatment that they need. That's why I work with one of our colleagues on this committee from North Carolina, Senator Tom Tillis, to introduce the Medical Supply Chain Resiliency Act. Our bill, as you may know, would give the President the authority to collaborate with our allies across the world to help diversify our supply chains, to increase access to critical medical goods, and to mitigate the effects of public health crises. Today, the medical supply chain backlog continues to affect access to life-saving medications, with over 140 medications listed as active drug shortages, over 140 by the FDA. Improving supply chain resiliency in the U.S. has never been more important. A question, if I could, for Dr. Hernandez. Dr. Hernandez, in your testimony, you emphasized the importance of drug manufacturers to build resilient supply chains. Can you just discuss with us for a couple of minutes how we as lawmakers can incentivize drug and medical product manufacturers that invest in secure supply chains?
Thank you for the question, Senator. I think the idea could be to pay more providers when they select drugs from resilient supply chains, and there's some discussion about how that could be achieved in terms of how you could set up the payment system. But the idea would be that to not reimburse always the same regardless of the generic version selected, but rather reimburse more when hospitals and potentially pharmacies purchase drugs from manufacturers that have invested in redundancy, in upgrading factories, in upgrading equipment, in having some backup production lines, for instance, if the first one shuts down. So I think that could be the idea.
Thank you. Thanks very much. A second question, if I could, for Dr. Wasinska. How do you pronounce your name? Wasinska? Okay, thank you. A question on lessons learned capacity building. We heard discussions that in efforts to produce generic medications inexpensively as possible, drug makers are limited in their ability to invest in building manufacturing capacity and ensuring quality. We've seen several instances where demand for a drug is underestimated, and then we're caught unprepared and unable to adequately ramp up production. For example, last fall, and I think last winter, we saw a crisis of children battling an early severe flu season alongside RSV and COVID-19 surges. Hospitals were at capacity while parents were facing empty shelves where children's over-the-counter fever and pain reducers should have been. Even members of my staff have shared stories of the fear they experienced while caring for their own children when they became sick with fevers without access to medication as simple as Tylenol. The unexpected high demand for these common medications led to their shortage, and yet they were not included on the FDA's drug shortage list. It's clear that we need to work together to find a long-term solution to build manufacturing capacity and oversight to ensure we have the capacity to, capabilities rather, to adjust and meet demands as they arise. Here's my question. I often say that we need to find out what works, do more of that. In that spirit, what do we learn from the shortcomings like this, and what actions should the Congress, and in particular this committee, consider in order to ensure that we're prepared for a future crisis that faces such unexpected demand?
Thank you for this question. It's a really big question, so I'll just highlight a couple of things. So preparing for dramatic demand increase, it can be done two ways. One is by having inventories of materials or finished dosage product. Another way is to have spare capacity and be able to turn it on quickly. So those are sort of the two ways in which you can ramp up production, or have technology that's flexible enough that where you can sort of switch the line to something else. So those are sort of the ways through which one can prepare for increases in demand. And that's actually sort of the space where BARDA has been really active, because it is, in a sense, that's what pandemic preparedness is, or CBRN threats. Those are all about massive demand increases for products that can occur, which is somewhat different in terms of how we prepare for this than for manufacturing quality problems and the sort of economic drivers that we described.
All right. Thank you
Time of my
both.
colleague.